A lot of people who write on forums to do with Cauda Equina Syndrome are commenting on the fact that they found it really difficult to get the health professionals to listen to them and to appreciate that something was wrong and was sufficiently wrong to require urgent or emergency treatment. I sympathise with people over that because despite being medical myself, there was a lack of appropriate emergency decision making in my case that had a serious outcome. Everybody is different, and there may be few people out there who have exactly what I suffered from, but there are some. How could the patient make a difference? They could, if you could empower them, but it's difficult if they're in a lot of pain, to be insistent with the doctor. I really must, and I would go so far as to say, to even indicate that they might sue if no action happens. If they could be sufficiently empowered to that degree, they're going to find it easier to get the investigation done. So the patient can make a fuss, and this is very effective in the system. If you make enough of a fuss, sadly, you'll have more success than the person who makes no fuss at all. Unfortunately, this is the way, and a lot of people feel, though less so I think today, but they feel they can't challenge the authority. So the problem that these people get stuck in, where they have an emergency situation, they don't necessarily know how urgent it is, but they do feel something's wrong, something's not happening that should be happening. First of all, this authority issue needs to be dealt with somehow, whether that's by being emphatic with your doctor or physiotherapist or whoever it is giving you the message that nothing needs to be done. Somehow you need to be empowered. It would be great if you could be empowered by a friend or relative, that somebody should be rooting for you because you're not in a condition to be fighting this battle that you're fighting. He should consider paying for a scan himself, or herself, if it is possible to do that, and I believe it is possible to do that, and all that's required possibly is for you to fill in some stuff online that they look at and say, okay, we'll scan you. I am talking about outfits that are run by radiologists, where they're providing an imaging service, but in the private sector. I believe it is possible, or if not possible, they might say, well, just get a brief note from your GP. But what is also possible is to go to a clinic where you'll have a private assessment. What I've read is 15 minutes. That's okay, 15 minutes might be enough. A 15-minute private assessment that gives you access to the investigation, because what you need is a scan. You're not going anywhere without it. Nobody's operating on you without that. The scan will immediately tell you, in most cases, whether you've got a serious problem